much, Mr. Speaker. This pandemic is very far from over. So with cases soaring across the UK, I'm surprised the Health Secretary is planning to end all COVID measures. The Delta variant, which was allowed into the UK due to the failure of border quarantine, is twice as infectious as the original and is infecting younger age groups, including children. It also shows significant vaccine escape, with only 33% protection against infection from the first dose. While receiving 2 doses of either vaccine dramatically reduces hospitalisation, the numbers are rising, and only half the population are fully vaccinated. That means the other half are not, and many won't have that opportunity until near the end of September. The Secretary of State talks about the percentage of adults that are fully vaccinated, but he must know that isn't how herd immunity works. It's achieved by reducing the number of susceptible people in the whole population to stop onward spread of the virus. The UK government's failure to lock down last September allowed the Alpha variant to emerge in the southeast of England and spread across the UK and indeed the rest of the world. So if the Health Secretary is going to just let it rip, how does he plan to avoid generating yet another UK variant with even greater vaccine resistance? With over 150,000 people dead, why has he returned to the false narrative that COVID is just like flu? Is it just wishful thinking? And why is he planning to end even simple measures like mask wearing? He has suggested people need to just learn to live with it, but appears to be completely ignoring the risk of long COVID, which is already affecting over 1 million people, including children. So how does he plan to avoid soaring cases of long COVID in unvaccinated young adults and children? Does he consider them to be collateral damage or just a price worth paying?
Mr. Speaker, I have to say the Honourable Lady, she started off well, but her points that she made just completely degenerated into political point scoring. And she should know much better than to engage in scaremongering of the Scottish people, of the British people. And she has no respect for what is happening and trying to treat this whole issue with a degree of respect and seriousness. I mean, she's using phrases like "let it rip." If anything, Mr. Speaker, the only part of the UK where cases could be described as ripping would be in Scotland, where the case rate is higher than any other part of the UK. In fact, I think they have the 7 of the 10 highest hotspots in terms of number of cases throughout Europe, and the Honourable Lady should reflect on that. And then she claimed that I suggested that somehow that COVID is like flu. I've never said that. It would be complete nonsense for anyone to suggest that COVID is like flu. She should think about the millions of people across the world, the thousands that have died in the UK. I think, how dare she suggest it's like flu in even raising that. The issue when it comes to flu, Mr. Speaker, is to say just as we have had to learn to live with flu, when in some years we've had 20,000 deaths, sadly, from flu, we have to learn to live with COVID. The Honourable Lady should reflect on what she said and stop playing political football with this serious issue.
The House, Peter Bottom.